Good afternoon, everyone. My study focused on the effectiveness of health promotion intervention in reducing cyberbullying among technical college students in Anuradhapura. To begin with, what is cyberbullying? Cyberbullying is an intentional act of aggression aimed at harming an individual through electronic means or device. The impact of the cyberbullying not only confines to its victims, but also consequences are faced by all parties involved. The need for the study. Within the Sri Lankan context, around 81% of students between the age of 14 to 17 are experiencing cyberbullying. But studies are just limited to secondary and tertiary institutions. What about the vocational institutions like College of Technology, which comprises vulnerable students who come from diverse socioeconomic backgrounds and early school dropouts? And also the existing prevention programs lack effectiveness, long-term impact and sustainability due to poor ownership and engagement of the students. As a result, this paves the way. Health promotion is an ideal approach to address this issue. Focusing on the objective to assess the effectiveness of health promotion intervention in reducing cyberbullying among students at the College of Technology by addressing its underlying determinants. How was the study conducted? The study behind was a quasi-experimental pre-post test design. Setting was the College of Technology Anuradhapura, targeting population all students between the age of 17 to 24, recruiting both genders, and a sample of all eligible students. The study structure conducted focused on three phases as the pre-interventional phase, interventional phase, and the post-interventional phase. Pre-interventional phase focused on the development of the self-administered questionnaire, which was translated into singular, pre-tested, and the pre-data was collected. The interventional phase, where the health promotion intervention was concurrently developed with the continuous participation of the students in designing and implementing a conceptual framework as an interventional process, which comprises of initiating, maintaining, directing, monitoring, and modifying the process. The content of the process could be explained in four main steps. As step 1, initiating the process and setting the code, where the students were engaged utilizing the existing link, new links, and employing activities to develop a rapport and facilitate initial discussion with them. Based on this, a goal was developed with the concept of the theme, spot it and stop it, where students acknowledged that understanding what cyberbullying is, they could spot it, and with proper action, they could stop it. Having this as the fundamental, we identified and clarified determinants. Group discussions were facilitated to identify determinants, and determinants were incorporated from pre-data, tools, and literature. A list of 17 determinants were identified, and clarification was facilitated by the development of waves and ecological models to understand the association. And these were prioritized based on the importance and feasibility to address them, based on voting. Around 5 determinants were prioritized, like lack of knowledge on harmful impacts, resistance to cyberbullying, glorification of cyberbullying, lack of peer-to-peer interactions, and problematic social media usage. Moving on to the crucial step, designing and implementing activities, where activities were designed in order to address the prioritized determinants. Activities like Icebreaker gave the platform for students to interact how they had involved and experienced cyberbullying. Activities like Compliment Box gave them space to encourage students with their positive feedbacks. Posters development focused on enhancing the knowledge and dissemination based on cyberbullying. And also, miming activities provide platforms to enact scenarios of cyberbullying and effectively detangle them. And also, when focused on reflective work, it gave the platform for students to acknowledge what are the preventive strategies they could use. And finally, the traffic calendar, where the problematic social media usage was addressed. Collectively, all these activities focus on addressing the determinants of the health promotion process that was prioritized. Moving on to the step 4, monitoring and follow-up. Where obstacles obstructing the health promotion process in addressing the determinants were facilitated to identify and clarify and address them. And the follow-up methods, the students focused on implementing monitors, and the sustainability was ensured by developing anti-cyberbullying clubs. The post-interventional phase. where post-data collection utilized the same self-administered questionnaire, and the data analysis focused on descriptive statistics and inferential statistics like the skyscraper. Moving on, what did the results reflect? Among the 19 behaviors studied, 7 most experienced behaviors are listed in the screen. When we focus on impersonation, it was experienced by 42 students before the intervention during a 3 months phase. And similarly, students' involvement in cyberbullying, for example in mocking messages, around 32 students reported involvement of cyberbullying. So what did this intervention bring about an impact on? So focusing on the changes. We focus on the changes on the students experiencing cyberbullying, impersonation to harm, which was 42 before the intervention, dropped to 22 at least once experiencing this particular behavior. This change was statistically significant. And also, changes in students' involvement in cyberbullying following the intervention, considering mocking and insulting messages, which was 32 before the intervention, dropped to 11 following the intervention. This change was statistically significant. And also the study focused on the changes in attitudes on aspects like severity, empathy, harm, prevention, and etc. Focusing on the nature of severity, around 22 members responded that it had severe impacts before the intervention. But following the intervention, around 35 members agreed upon it. This change was statistically significant. Moving on, the change in the students' confidence in handling cyberbullying. As you can see, during the pre-interventional phase, most of the responses was in the no and low confidence range. But after the intervention, there was a positive shift towards moderate and high confidence. At each level, this was effective. When we focus on the individual level, the negative perception was reported as 20% agreed, and 34 students agreed after the intervention, which was statistically significant. Focusing on the discussion, the study reduced the experience and involving of cyberbullying by shifting positive attitudes, and also the study was based on a setting which was uncommon, with a common theme of spot it and stop it, which include both the perpetrators and the victims, which added strength to my study. And also the study was a pre-post test, which lacks a control group, acts as a limitation. Focusing on the conclusion, the health promotion intervention conducted with the students at the College of Technology has significantly reduced cyberbullying by addressing its underlying determinants, as it enhanced students' knowledge, attitudes, skills, and practices. Focusing on the recommendation, we can expand future studies on similar settings of larger population with longer duration, and prevention strategies could work involving all parties. That's it at my end. Thank you very much.
Thank you, Ms. Thirulogasanker.